All right, welcome everyone. Just to let you know, we are recording this so that you are aware. And the reason we're recording is because MCTV is going to post this discussion on their platform, and you'll be able to watch it and rewatch it many times. So I'm Lena Chowdhury. Most of you know me, faculty member. I'm also chair of the Community Engagement Committee. And the Community Engagement Committee has been tasked with bringing in a speaker every semester for our Reflections with a Nurse. And the purpose is to have an opportunity for the Montgomery College community to find out what is life like after nursing school, that there are many different paths and many different rewarding opportunities. And so we'd like to give you a taste out of just what you get while you're in school. The other my colleagues are here also from the Community Engagement Committee, and I would like to now introduce our speaker, Kristina Hofmann, and I'm very excited to introduce her because we go way back. She's a student of mine many years ago when I was teaching at Anne Arundel Community College. That makes me very happy and very proud. She went on to get her bachelor's degree at George Washington University. And her first job out of nursing school was with Mercy Medical Center on the orthopedic and medical surgical floor. She then went on to work at Sunrise Senior Living as the acting residential care director and wellness supervisor. Then she moved into community health, which is my first love as well, community health, working for Howard County. And now she's working for the state of Maryland. So I'm really excited to introduce Kristina Hofmann and to hear more about her career trajectory. So thank you, Kristina.
Yeah, of course. Thanks for having me. I'm excited.
Hi, everyone. My name's Professor Moreno. I'm one of the faculty members at Montgomery College. I currently lead the Maryland Clinical Simulation Resource Consortium. So it's wonderful to see our students. I don't get to interact with them as much, but we're excited that you were able to come out and join us today. Kristina, thank you so much for coming out. Lena, thank you for sharing that introduction. So I'm going to start off with some questions, and then other members from the community engagement group will kind of follow up, and we'll just kind of have some dialogue regarding your current role, what you've done in the past. And we will have time for students. If you have any questions, you can definitely post them in the chat, and we have someone monitoring them. And we'll try to infuse some of those questions throughout the session and definitely try to get them addressed by the end of today's session. So does anyone have any questions before we dive in with the first question to Miss Kristina? All right. So your history and your work is vast. You've kind of been everywhere. I was like, wow, Mercy and then Howard County, and definitely very interested to hear a little bit more. But to get us started, can you tell us more about your current nursing work?
Yeah, so currently I am the nurse manager and consultant at Maryland Department of Health. I work under the Bureau of Infectious Disease. So that's more like involves outbreaks. When I was hired initially, I started running what's called the TAT team, the Tactical Assistance Team. And we dealt with COVID-19 outbreaks in long-term care facilities, skilled nursing facilities, and assisted living facilities. And we really, this is throughout the state of Maryland. So I oversee a team of nurses, and we've been deployed out to kind of help go into those facilities and manage any of those outbreaks for COVID specifically. But now we're working alongside local health departments and also partnering with the epidemiology team. And we help control outbreaks such as like any other outbreaks they might have, like respiratory viruses or GI outbreaks. So we kind of give the facilities guidance and help them manage disease in their facilities. So pretty cool.
Very cool. So I'm curious, how did you get interested in this field?
It's a great question. So I've always wanted to I wanted to go into public health policy initially. And I think I had this dream before starting nursing school. And then I kind of got this idea in my head, like, let me, start out with, obviously you've mentioned Mercy. So I wanted to do bedside acute care nursing just to get like a, foundation in nursing. And then as the pandemic hit, after, years of trying to figure out where I would fit, and I wanted to understand long-term care, because for me, public health policy, I wanted to get into, CMS, which runs Medicaid and Medicare, and wanted to get into governing, regulations in long-term care facilities. So working for them was kind of how I wanted to start with that. And then when the pandemic hit, I applied for a job at Howard County Health Department. And it was perfect timing because the pandemic had just kind of come on and they needed people in outbreak response. And so I just kind of got pushed into that. Initially, I was just going to be a community health nurse. And so I started out with COVID-19 outbreaks. And I think honestly, being so, immediately immersed into that, it opened up my eyes to infectious disease and, communicable diseases. And I just found that fascinating. And also, how you can help the community in controlling these diseases. So that's kind of what started. It was just kind of natural in that I just kind of fell into that position, and then was like, wow, this is amazing. This is almost fate that I'm here. So yeah, it was pretty awesome.
Great. Thank you, Kristina, for explaining to us what got you interested in the field. My name is Martha Huff. I'm one of the full-time faculty members in the nursing program. Can you tell us what credentials do you need for your specialty?
Yeah, if I can ask, do you specifically mean my role or public health nursing? Like, I can be vague or I can be specific.
How about both? I'm sure the students would like to hear.
Sure. So for public health nursing, for community health nursing, like if you wanted to get into a local health department, you really just need to have an RN. And other credentials such as you have to have your BLS and CPR certified, but most of the time they ask that you have some kind of experience, whether it be in a clinical setting, acute care, such as or any of those kind of settings. And then from there, if you want to get into any of the other roles, you can get other credentials. So say you want to go into infectious disease, one of the credentials they've been kind of seeking for the nurses to get now is a CIC, which is a certification in infection control. But the great thing is the health departments kind of help you get there, and they will support you in trying to get those credentials so that you can get into those roles. And then if you would like to get into my position, if I want to be specific, yes, you do need to have infection control and public health experience. So both. And you also will need to have supervisor experience, which I started out as just a community health nurse. I quickly, I think within 6 months, moved to a supervisor position. And then from that role, I got recruited into the state as a nurse manager. So, and that was really, I've worked hard at leadership. I took leadership classes and just kind of worked hard at understanding what it would take to be in one of those roles. And that's kind of what got me there. So those are, they do ask that you take leadership classes at the state so that you can get into nursing leadership and, if you want to be a supervisor. So that's another credential you'd have to have. But yeah, mostly just your RN to get started. So start there first. And then, yeah, if you want to work your way up, there's so many things you can do within the health department. So there's all the options.
Wonderful. Thank you very much for that information. Can you tell me what changes do you expect over the next 10 years in your field? If any?
Well, unfortunately, with politics, how heavily they got involved in public health, it could go either way. I would say that there already was a need prior to the pandemic, for just robust public health infrastructure, which it didn't exist, and it still doesn't exist. But I think the pandemic helped highlight that. So, in the next 10 years, this is my hopeful answer, public health infrastructure will grow, and in infectious disease, especially because we are seeing outbreaks, and we're going to continue to see new outbreaks of different types of diseases. We've and I got to work on even monkeypox. So we've seen monkeypox is a new disease. We're seeing measles outbreaks, obviously, because of low vaccination rates or vaccine hesitancy. So I think we need to grow our public health response, because should we have another pandemic, we're not going to be prepared. And I think it's really important that just as a country, and I mean overall globally, I think we need to have a good public health response, so that should a next pandemic happen, we're prepared and we can respond accordingly, and we have the resources to help people and not lose so many lives. So I think that's where I see the next 10 years. But yeah, we'll see. I'm trying to be hopeful, but yeah.
Thank you very much.
Yeah, of course.
Hi, I'm Jamie Sue Wright. I'm another full-time faculty at Montgomery College. So wanted to know, because you touched on it a little bit about the pandemic, but how did the pandemic affect your work and your mental health?
Got this. Do you have time? That is, yeah. So the pandemic definitely affected. So I would say work. Obviously, I started off in the pandemic. As soon as COVID began, I started working in it. And the guidance or lack thereof, we didn't. Science was changing and evolving so quickly, and we had to adapt. And we were trying our best to kind of respond and be ahead of it. But often we found ourselves kind of behind, and so it was very stressful, for sure, in the beginning of the pandemic, just because we wanted to know what we were doing, and we were trying everything we possibly could, and it was a challenge at first. But I think as science evolved and as our guidance, we started to establish things and understand things, we could implement things that were helping people, and we could see that in real time. And that was, looking back on it, it's awesome that we got to be able to be a part of that, and help create that for, facilities that have the long-term care facilities specifically, and even the hospitals. They had, high risk patients, and the most vulnerable people are there, and you, during the pandemic, want to protect and, help save lives. I mean, that's what we do as nurses. We want to help people. And I would say, work-wise, it was hard. And then I would say once politics kind of got into it as well, it definitely challenged us. It made more resistance from people kind of collaborating, helping, and so that was also a challenge in our work. But as far as I was concerned, in my team, we worked effortlessly. I mean, we worked not effortless, sorry, tirelessly, around the clock. I probably worked maybe 8-hour days. So when we get to mentally, we were definitely, during the pandemic, we were in the state of adrenaline and the height of things, and we weren't really thinking much. I think a lot of us pushed back, like our own fears and our own thoughts. Maybe that's what more was driving us to work so hard. But mentally, I remember it was like the end of Omicron, which was, if you guys remember, that second big wave that we had. a lot of, and it wasn't just me in public health, I could see a lot of healthcare workers were really starting to feel the effects of the pandemic. And I think things started to slow down and everyone kind of was either burnt out or we definitely started to understand, well, what did we just go through? And that was, pretty impactful. And it was hard. And I think we just, didn't acknowledge that during that time. So mentally it was hard, but I would say there's been so much within that like within my time working in the pandemic that I feel like we had our highs and our lows. And I think the highs, obviously for me, because I'm very passionate about public health and what I'm doing, the highs for me kind of kept me going. And the lows, obviously, you have to figure that out and address that as it comes. But and they're all lessons to be learned, of course. But yeah, so that's kind of how it went. Pandemics are hard, and every one of us have went through it, and I think everyone was affected mentally and in some way, shape, or form. So yeah, it was a challenge for sure.
Yeah, absolutely. Thank you for sharing that experience.
Yeah.
And speaking of experience, what would you say is your most cherished memory about your nursing career?
Overall, or like in the pandemic?
Overall.
Um, Most cherished memory. I have lots. I think I would say that my most cherished memory would be probably, this is pandemic related, the vaccine clinics that we provided. And I say that they're my most cherished memories because I think that was the point where I understood, not only why I was there as a public health professional, but why I wanted to be a nurse. And so I remember that we started vaccine clinics and we vaccinated everyone from educators to healthcare workers, residents in nursing homes, people that worked at the hospital. I mean, we were the first to open up clinics and have the vaccine. And I just remember so many people being so grateful, and there were people that were crying, and not because they had, they were afraid of a needle. They were more excited for hope, and they could kind of see the light, and I think that for me, I got lots of hugs and people were so grateful and they really thanked us. And I think I was just kind of reminded, like, this is why I do what I do. I want to help people. And even just giving them the vaccine to help protect them from a disease that, was killing people and making people severely ill. That was just incredible. And the feeling of just being able to be there for them. Yeah, that's why I would say that was my most cherished memory for sure.
It's
That's a
amazing.
beautiful
Thank you.
reflection.
Yeah.
That feeling of service or value of service, I think that's common through this whole group, all
Yeah.
the participants. So my name is Kate Snyder. I'm one of the full-time faculty members, and I'm wondering if you could offer our students a few recommendations on do you have any recommendations for success?
I have many recommendations for success. But I would say start with if you're here for the reasons that most of us are, we're passionate, like you said, the value of service. If you're passionate about what you're doing, if you just kind of continue along that, feeling that way and remembering that you want to do this because you believe in it. And this is, I think you'll be successful. I think that will be the motivator for you to kind of continue forward. Other than that, I would say successfully, don't be afraid to talk. don't be afraid to talk to people and to be vulnerable and to open up yourself, because you don't know, there's so many opportunities that you can have in nursing. And I think just, sharing a bit of yourself with others and connecting in ways can really open doors for you in nursing, for sure. So I think that's aside from, study hard and make sure you're on time.
Mhm.
I am a nurse manager, so I have to say these things. But yeah.
Yeah, I'm at a conference right now, and one of the stress management techniques they were talking about is always having your why in your pocket. So if you're having a bad day, you just stop for 30 seconds, you take a deep breath, you remember why you're there. It's,
Yes.
it's your personal mission statement.
Yeah, and I think I don't know if many of you know Simon Sinek. He's somebody who's kind of changing leadership in the workplace, and he does say that too. Remember your why. So I think that's so important, because yeah, that should be why you're working.
And it can, on a rough day, it gets pushed back.
Exactly. Yeah.
So I wonder, just reflecting on your career so far, if there's anything that you'd change about how your path has gone, whether it's like your path to nursing school, through nursing school, or career-wise since.
There's probably quite a few things I would change. I think, and I did think about this. I've been thinking about this for quite some time. I wish I would have gotten more exposure in nursing school to community health. I know that there's some pieces that you get, but I wish that maybe there's, more working with local health departments to kind of see more of what they do, because a lot of it, for me, I found in where I worked, at least, I found a lot of people that were very passionate, and I also understood so much more about, what public health is at a local level, and different things you can do, and opportunities for nursing. So I kind of wish I would have had more insight to that. That's just me personally speaking. That would be the one thing I would change. As far as my career goes in the future, change. I hope that public health, like I said, I hope it can, we can build a stronger foundation for it. And I think, I hope that I can be a part of that. And I hope that maybe we can put more politics aside and kind of come together on, believing that we need to provide public health for both sides. So yeah, it's kind of, those are the things I would change.
That's glorious. I wonder, maybe we can set up some service learning events with your public health department, and we can get these students, anyone volunteering, to kind of see more like what public health is doing,
Yeah, for sure. And I know I've worked with Montgomery Health Department as well. And I know that they have a good department there. And I think
Excellent. We'll network.
yeah. So anyone is welcome. I think there's internships at a lot of the health departments that people aren't aware about. And it's good to know that you can apply for these internships and kind of work there with them. And just even if it's a summer, you can just kind of go in and I mean, they have you doing light things, but you get exposure and you can talk to people, and you get, like I said, you can kind of see what's going on from that aspect of things, and see if you're interested in any of the things that public health has to offer.
That would be awesome. I wonder, before we get into the chat, I know I've already been putting questions in there that I want you to answer. So before we move on to questions that are posted in the chat, do you have any final thoughts, any wrap up that you wanted to share that we didn't get to ask you about yet?
I'm sure people have a lot of questions. I don't think I have anything off the top of my head right now. I apologize. It's a long day at work. My brain's functioning on like 70%. But I'm doing my best. I promise to be my best. So.
Thank you so much.
Do you guys want me to look at the chat or?
We're gonna ask you.
Okay. Okay.
I will. Hi, my name is Matewo Mahapelo Raposo. I am one of the full-time faculty. Can you all hear me? I think
Yes.
you can
Hi.
hear me. Yes, Mati in short, and I was monitoring the charts. But before we go to the charts, I think I have one question that was burning that I wanted to follow through, and then I will talk about what I saw on the charts. You talked about the experiences. Someone had asked you about the experience you all had, mental health experiences, and I wanted to know what continuing self-care programs does your department do to ensure that everybody's mental health continues to be well, having gone through all that stressful event?
That's a great question. And I can answer that. We obviously have, employee assistants. We had counselors that worked, offered to reach out from the state. You could, at the time they offered services, so you could sign up if you wanted to have some counseling services. So they did offer that at the state level. And that was for all of state workers. So anyone in local health departments, they also are under the state umbrella. So we did have that option. Such a good question. And then we also had meetings, discussed, what changes we wanted to make to kind of improve our, our mindset and mental health. So that we were asked, our input on how can we make things better for everyone. I know, we were being seen and understood that we were struggling. And so we did things like we changed our work hours. We stopped working weekends. We kind of, suddenly developed boundaries that we should have had, but was hard to during the pandemic. So that was, I think, very helpful for a lot of us, especially if you have a family, and we were kind of neglecting families to work. So it was nice to have that work-life balance kind of put back in. So yeah, that's kind of what we did. And like I said, if anyone wanted to use the counseling services, they were there, and I thought that was really awesome. So yeah, good question. That was a great question.
Thank you very much. I don't know if the people who put some charts here would like to say what they wanted to say, or they want me to.
Yes. Oh, I can. Yes. Hi. Hello, Kristina. It's Martha again. During the pandemic and after the pandemic, the hospitals and nursing facilities experienced a large nurse attrition because of the pandemic. Did the public health sector experience the same?
Yes. Yes, we did. We lost a lot of people due to kind of, burnout. And a lot of even, so my boss at Howard County, who was the medical director at the time, Dr. Menencherry, she left to go work for the state because, she needed a change of scenery and a kind of change in her life too. So I saw it all across the board, everyone from administrators to even just the guys who did environmental health services. They even, a lot of turnover, a lot of people left that had been at the health department for a very long time. So, and it was shocking. But I think what the pandemic did, even though obviously everyone's having that mental burnout, it highlighted, it kind of really exposed, I guess I should say, a lot of issues in a lot of places, a lot of workplaces. And I kind of don't know why or how. I mean, I guess I could come to a lot of theories, but I don't know exactly what it was. But and I think people, felt that and saw that, and maybe did they need to make their own change in their own life. But so yeah, a lot of turnover in public health as well.
Thank you very much for that. And I like to say you did bring up about the the vaccine locations and things. I must say that every time I went to get my vaccine and I took my son's, I had a huge sense of pride at the work that you all were doing. It was absolutely amazing. And
Yeah.
I was very, very proud to be a nurse every time I took my family to get their vaccines. Thank you.
Awesome. That's so great to hear. Thank you.
Okay, students, would you like to ask some questions before I go back to the chats? Feel free to ask.
Don't be shy. I'm here to recruit you. Come to the public health side.
Okay, while the students are still thinking of the questions to ask, we talked about a lot of things, and I think I shall start from the most recent that we talked about. You mentioned that the students could maybe it was Professor Snyder who said, and then regarding the internships, and somebody wanted to know how would one find the internships that the students could do, and I think Professor Chowdhury put that through Montgomery County. But how else can they find the internships?
Like in one of our songs, she's just sending like, "Hey, how are you?" Like, so.
Sorry.
I missed that.
Yeah, so the internships you can find just by contacting your local health department. I would say that's probably the easiest way is to call them or to email them and just ask, because they don't really advertise it as good as I think they should, but they have not. So I found that a lot of people that I've in the past that I've gotten internships for, I've, given them the phone number and they've called and they've gotten an internship, and they're really willing to offer it to anyone who's interested because they think it's an exciting experience. And we kind of, also public health, we get the help from someone else coming in to kind of help us. So it works out both ways, obviously. But again, you get so much more out of it just by being there and kind of learning from the experience. So yeah, you can call or email. Or you can go online and just kind of Google the health department, Maryland Health Department. You can look up internships and stuff. So it's pretty easy to find.
Great. Can I ask one of my questions?
Yes.
You talked about how you'd like to see public health infrastructure improved. I wonder if you have a vision for that. If you were governor, if you had the money, what would you like to see?
If I was governor, you see, I'm not sure that from a governor, but yeah, let's say that I could improve upon things. It really starts with, I think, education and communication to the public. We've kind of seen that, right? The CDC struggled so much with constantly messaging back and forth and how they were, relaying messages. And then it's the way it's perceived by some, it's not perceived by everyone. And so I think there needs to be kind of more focused education and messaging to people. And I think that's where I would start. I think that's, public health, that is one of our pillars is education, because that's kind of where we start with educating and kind of trying to prevent things from occurring and making sure that people are aware of resources and stuff. So we try to be proactive and, so I think, yeah, that's probably where I would start. If I had all the money and the funding, I would hire obviously more nurses to educate and to provide more services too to the public, I think. But yeah, getting the word out there. I am, just a person, living in Howard County. And for me, it was like, I had no idea that these services existed. Once I worked for the health department and then I found all these services, how do you get this message out to people? Because I had no idea. And if I had no idea, there's so many people that don't have a clue. So, how do you kind of convey that to the public. And I think that's really important, is how we're delivering the messages and stuff. And it's hard because obviously, like I said, politics plays a big part right now, and social media and the way things kind of get misconstrued or changed in how they're portrayed. And I think yeah, that would be where my focus and money would go towards strategizing how do we sort of fix that.
Is there any one educational topic that you'd love to focus on? Like, what's the biggest need that you see?
There's so many. Depends who we're talking. Overall,
Mhm.
I think vaccines right now are becoming kind of the hot topic, and becoming more of an issue. We've had less, I think the rates for vaccines were like 93% or something, which in children, which was lower than it's been in the past. And that's a problem. And I think that's one of the many areas. I don't really have a specific, there's so many that I would want to address. So, but vaccinations would be a big one for sure. Yeah, that's a good question. I have to think about that one. Write out my plan.
Coming from the chat, I see Professor Chowdhury has unmuted everybody. If you have the opportunity to unmute yourself, if you want to ask a question. But I'll read one question from a student. Given the prolonged duration of the COVID-19 pandemic and its impact on mental health, what specific measures in the public health department, is the public health department implementing to address increasing rates of anxiety, depression, and other mental health conditions in our community? And then there's a follow-up question from another student after you answer that.
Yes, that also excellent question. I love that because I think we just did a social health determinant. We just did a focus study on that. So I digress. But yeah, we as a community realized, how the pandemic had affected, and we take statistics, right? They look at the community based on like polling and surveys and reports that you get. So there's people that collate all this data and analyze it, and we get statistics based on even the rates of certain diseases or illnesses. And I think depression, suicide, and anxiety were very high. And so it was kind of, and it was specifically, and then it also goes to which group is the highest, and it was higher in men. So it was just we kind of take that data, and then we create, the health department. They've already have like kind of things in place, but what they do is they look at that data and they, I didn't work in this direct field, but they look at that data and they kind of branch out, how can we reach out and how can we provide resources and help? And I think, a lot of things was just kind of getting the message out, like, if you need help, here's the number you call, and just trying to talk about it. Like, don't, you don't have to be ashamed, or you don't have to be afraid. And here's resources. And we have mental health counseling here at the health department. So that was an outreach. That was, trying to get that out to the community. That was one of those projects that, they did a lot of community outreach for mental health. So that's a great question. And it was just more kind of focusing on getting that message out. So you would see more, even in social media, you'll see more not advertisements, I don't want to say, but more posts from the health department that say, if you need help, mental health, you're struggling with it. So it was more messaging geared towards that. But yeah, and so that is one of the things that they do. The health department does a lot of things. We have clinics, we provide mental health counseling, we have social workers, we have therapists, and I think they even have psychiatrists. So we can refer you out to a psychiatrist. So if you really are in need of help, we make sure that someone comes to the health department, we can get them the help that they need. I know that that's addressed, but I don't work in that field, so I'm not, I don't have all of the answers, but it's a great question. It definitely impacted mental health, and I think mental health is a huge area of need right now as well, for sure.
Okay, there's a student who says they're in the library, so they would like somebody to read this question for them because they cannot talk. Good for you, Mikala. Continue the library work. So Mikala says, thank you for sharing your journey. In your opinion, have nurses increasingly taken on a more active role in public health endeavors? What practical steps can nurses take to be more involved in public health?
Yeah, so answers to that question, yes, more nurses have actually been seeking public health positions. I think a lot of nurses are tired of maybe bedside nursing, or like we said, like there's a lot of attrition at hospitals and stuff, so they've burnt out from that, and they're seeking other ways to still be a nurse, and how can they utilize their skills. And a lot of them have found their way to the health department. So we have had a lot of nurses applying for the health department recently. And I think also the pandemic exposed public health and what nurses do within public health too. So you got, if you're a nurse, you kind of understood more and kind of got a little bit exposure to that. So I think people were now aware, hey, oh, there's a job at the health department that I can take. And there's a lot of, it's different, scheduling and stuff like that. So yes, we have seen an increase in nurses coming into public health. The problem is that they haven't created enough roles. They have to create more roles. And again, like I said, the funding needs to be there. Luckily, from the pandemic, we had the COVID-19 funding, so we could fund a lot of people. And they have expanded in many roles in many areas. They've expanded like different bureaus within the health departments. And so we have seen that there are more opportunities for nurses, but it's still limited. So it can be competitive when it goes to applying. But luckily, I think there's always hiring happening. So you just kind of stay with it and keep looking into it if you're interested, because there are roles that open up, or new roles that are created often. So just kind of being on that website, you guys can see more about that. Practical steps.
Yeah, there's that one more question that's really, I know you've been talking a lot and you probably need a sip of water. Thank you so much. But these are really good questions that our students are sending in. This one's asking, what does your day-to-day look like? And what are your current projects and goals your department is working on?
That's a good question. Day to day. Well, it used to look a lot different. Now it looks like a lot of meetings with a lot of people. So I do talk all day long, or I listen all day long, which, that varies. But so mostly I'm in meetings, and we are strategizing on projects. We're trying to create things. We're analyzing data. We're discussing data. We're discussing anything from infection control in facilities to what's our next adventure going to be in public health as far as our team goes. Like, what else do we want to get involved in? So the meetings happen throughout not only just the health department, but we also meet with local health department, and we meet with the facilities that we're working with. We meet with leadership in those facilities. And so we have high level discussions on, how can we help them more, and what does that look like for them? Because we have a team of nurses that can come out, and they have a diverse skill set of things that they can offer, from education to infection control assessments. And so kind of partnering with leadership in these facilities to figure that out. So one of our current projects that we're working on right now is we do education for facilities, and we've been focusing, and I'm not sure if you guys are going to be familiar when I say this, MDROs, which is multi-drug resistant organisms. And so we're seeing that in a lot of hospitals. We're seeing increases of that in many facilities, nursing homes specifically. And the problem is trying to manage these MDROs and educating facilities and their staff on what an MDRO is, and how to handle it properly in their facility. And by handling it, we take care of, teaching them the proper PPE or the proper precautions that the individual with the MDRO needs to be on. Because skilled nursing facilities, they hire, nurses, but they also have GNAs, and they don't always have this background of, learning all of the stuff about MDROs, like you would in nursing school or if you're working at a hospital. And so it was really about us getting in there, educating all of the staff. And so that's one of our projects we're doing, which is great because so a response to MDROs is called enhanced barrier precautions. And that we work with the project from the CDC, and we help them implement enhanced barrier precautions in these nursing homes. It's not required, but it's something that can help, and I think does help prevent the spread of certain MDROs. And
yeah, the second part to that question is what have you taken away from your previous experiences in patient care that has prepared you for your current role today?
Yes. So when I started working at Mercy Medical Center, we all had to kind of pick a area that we wanted to go into for, like they called it, a nurse residency. And that was anything from infection control to, I want to say patient safety. There were different topics you could pick, and you kind of had to do like a project in it, and you had to participate in a group. And my group, of course, was infection control. And so in that role, I got to go around and see different infections in the facility, such as Claudi or Klebsiella, or MRSA, if you're familiar with that, or even infections like post-surgical infections and stuff, and just what the team would do. And I just kind of walked around and kind of helped because I was, collecting data for my project. But what the team would do there was that they would take data and try and figure out ways of how do we prevent these infections from occurring so often on this unit, or how many we're getting. So and understanding, just kind of where the breakdown occurred, and all those things. So I think that helped prepare me for this role that I'm in now. I understood it very well, and I thought my thought process was the same as most of people that worked in infection control. And so now that I'm in infection control, I bring those experiences that I had just from understanding that, and even just basic infection control stuff such as hand hygiene, washing your hands, and PPE usage, like how you properly don and doff and stuff, that I learned at a hospital, and I use it now in my current role, and I help educate people in, like I said, other facilities too. So that's some of my experiences that I've taken from patient care. Yeah, I think that's the best
Thank
answer I
you.
have for you.
Yeah, that was great. Thank you.
I think I would like to add something that was put on much earlier, which I think is a good segue to what Kristina just said, regarding the courses that you mentioned earlier on, that you had to attend the courses. And every time we think about finances. So who paid for these courses? That was the leadership courses that you mentioned earlier on, because then in case somebody wants to do your position to join your department, how will they do it? The leadership courses that you mentioned earlier.
Yes, so the perk of working at the health department is that you get leadership classes are part of the program, so you can join them for free. They're free classes. They give you you can get books that you have to read, or you can order the books yourself, whatever you prefer, but they give you stuff to read, and you kind of take these courses, and a lot of the books are on leadership. So yeah, they provide the classes for you specifically for leadership, and then there is all kinds of different courses that you can participate in that the state is willing to help you either enroll in, they'll pay for it, or if they I think that they've provided funding in a lot of the local health departments for the other credential I mentioned, which was your certification in infection control, which is a really great, if you want to get into infection control, it is almost necessary. It's almost required, but it's not required yet, but it's amazing if you have that. If you have the certification in infection control, you can do so many different things with it, and it will really help you understand just so much about what your role will be. And there's so much within infection control. It's vast, but it's very interesting. So if it's something you like, look into it. And there's different levels. So you can take the CIC. There's also like a long-term care CIC. There's an APCIC, which I think is like, that's a very easy kind of basic test. It's basic infection control if you want to get some kind of certification. And I think it gives you like a year once you take that. And the courses in that are cheaper. The test is also cheaper, but the CIC is like the biggest test that you'll take. And I have taken it before, and I will say it's harder than you're going and you're thinking. It's a very challenging course, and it's also a challenging test, but I would say it's definitely harder than some of your college exams that you're going to take. Not harder than the NCLEX, I don't think. It's definitely possible to take. All of you are capable of taking it, but yeah, once you get that certification and you're in infection control, there's like it's endless for you, the opportunities in infection control at that point. So yeah, but I encourage everyone to take it. So please get it, because as a nurse, you'll find how important it is to understand infection control. And it doesn't have to be, you don't have to have a public health, degree. As just a nurse, even if you're on acute care, or you want to be in trauma, or you want to be in the ER, understanding infection control is paramount to protecting and saving people's lives. It's very necessary, especially nowadays with all that we have kind of going through the hospitals as far as infections go, and like I said, multi-drug resistant organisms and stuff. So yeah, it's very prudent.
Well, we're getting to the close of our hour here, and we've kept Kristina probably long enough, since she already started with a long day. But are there any burning questions from anyone? This is your last opportunity. Okay, well, then I think we will say good night, and thank you so much, Kristina. Wow, was that super interesting, and we really appreciate you taking time out to talk to us. Make sure
thanks for
that you
having me.
stay in contact, and we hope too that public health gets the
Gosh.
attention and the money that it deserves, because it's for all of our good, right? So thank you so much
Exactly.
again. Really appreciate it. And I really
Yes.
appreciate everyone who came to attend.
Thanks,
Of course.
everyone.
Thank you, guys.
Thanks,
Thank
Kristina.
you.
Thanks. Have a good night. Bye, everyone.